Welcome to Flagler Hospital's Joint Education class. My name is Sarah and I'm the orthopedic coordinator and a registered nurse here at the hospital. Now that you and your physician have decided that surgery is the best treatment for your condition or injury, you may have a multitude of questions and concerns. Planning for surgery can be overwhelming, but you can make it easier on yourself and your family by being prepared and knowing what to expect. This presentation is designed to walk you through each step of your surgical process. Our goal is to provide you the information so that your questions are answered and your stress and anxiety are decreased. Thank you for choosing to have your orthopedic surgery at Flagler Health Plus in St. Augustine, Florida. Our hospital's mission is to provide the best patient experience with the best staff. Our vision is to become a total care enterprise that advances the physical, social, and economic health of the communities we serve, and our physical therapy mission is to provide therapy that optimizes health, function, and quality of life. Our team of experienced and compassionate professionals is dedicated to helping you achieve an improved level of activity and higher quality of life. Flagler has a nationally certified orthopedic program as well as orthopedic certified nurses. These nurses obtained additional training after their nursing degree to learn how to properly care for our orthopedic patients. Flagler Health Plus has earned the Joint Commission's Gold Seal of Approval for its comprehensive total knee and total hip joint replacement programs by demonstrating compliance with the Joint Commission's national standards for healthcare quality and safety in disease-specific care. The certification award recognizes our dedication to continuous compliance with the Joint Commission's state-of-the-art standards. Our hip and knee replacement practices have been recognized by the Joint Commission since 2011. At Flagler Hospital, your orthopedic surgery and post-operative activities have been designed to help you return to most normal activities, including driving, walking, and most hobbies, within 6 to 8 weeks. Most of our orthopedic patients recover quickly and return to a healthy and active lifestyle. The amount of time you will need to recover is highly dependent upon your preoperative physical conditioning. The better your physical condition prior to surgery, the quicker and more successful your recovery will be. It is our belief that well-prepared patients achieve the best surgical results. Physical preparation, education, continuity of care, and pre-planned discharges are important to creating the best results. Flagler Health Plus offers each patient undergoing total knee or hip replacement an educational guide. Most patients receive this manual when they schedule their surgery at their surgeon's office. Your physician has discussed information with you regarding your surgery. This guide is designed to help you further prepare for surgery by giving you information you will need to achieve the best outcome from your joint replacement. Please read this manual. It will help you understand what to expect during your hospital stay, what you need to do before and after your surgery, and how to properly care for your joint replacement. Make sure to read through the entire manual. We at Flagler Hospital are here to clarify and answer any questions you may have about this material. Focus carefully on the preoperative preparations, such as the exercises, home preparation, and the important checklist. Research shows that patients who take an active role in their recovery experience the most positive results. Joint surfaces wear down due to arthritis, trauma, or other conditions. These surfaces are replaced during your surgery with metal or polyethylene. The goal of surgery is to decrease your pain and increase function. Things you can do to prepare for surgery is go through the preparation checklist in the patient education manual and make sure you have completed everything on the list, which applies to you. Smoking cessation? If you smoke cigarettes, it is important to quit before your surgery. Smoking can slow the recovery process and increase medical complications. Diabetes management. It is very important to effectively manage your blood glucose before and after surgery. Managing your blood sugar can reduce complications such as infection. If you are a diabetic, your blood glucose will be managed and monitored throughout your entire hospital stay. Infection prevention. Bacterial infections commonly enter through the skin. You will be given directions from your surgeon's office and during your preoperative interview at the hospital with instructions on what to use to properly bathe before your surgery. Home safety. Falls are the most preventable cause of injury. Make sure to remove all of your throw rugs in the home. All stairways in and around your home need to be secured and have handrails. Install nightlights in stairways, bathrooms, hallways, and pathways. There should be no long cords, footstools, or clutter in or around your walkways. Furniture needs to be arranged so that you can easily move throughout your home and bedroom with a walker. Pets may need to be moved to another area of the house when you arrive home. If your bedroom is located upstairs, you may need to prepare a sleeping area downstairs for the first few weeks after you return home. Help at home. You will need to arrange for a friend or family member to drive you home from the hospital and to your appointments after surgery until you are off of your pain medication and walking independently. It is also encouraged to have someone stay with you for the first week after you return home if you live by yourself. If this is something that you need help with coordinating, our hospital has a coordinator who can assist with making these arrangements for you. If required, you must make an appointment with your primary care physician to obtain medical clearance for surgery. This appointment lets your surgeon and the hospital know that it is safe for you to have surgery. If you have any specialists that you see regularly, like a cardiologist or a pulmonologist, you must also get clearance from them as well. This is an extremely important step in the process to have surgery. Please complete this in a timely manner and do not wait until just before your surgery. Without medical clearance, your surgeon will not perform the surgery. Communicate with your doctor's offices. It is helpful to tell them when you are having surgery and that you need this done as soon as possible. A pre-op appointment at Flagler Hospital, sometimes called a PAT or a pre-op interview, is required for all joint replacement patients. During this appointment, a pre-op nurse will review your medical history and medications, assure that all consents are correct and signed, and give you instructions about when to arrive on the day of your surgery. They will also go over what medications to take on the morning of your surgery and any other preparation. For your safety, it is extremely important that you tell the pre-op nurse all of the medications you take at home. In order for the nurse to make a complete and accurate list of all your medications, have a list of the names and doses of your medications, including prescriptions, vitamins, supplements, herbals, and any other over-the-counter medications. If you have any questions regarding your pre-op appointment or about your medications, please contact the pre-op department at Flagler Hospital. Again, the pre-op nurse at the hospital will tell you which medications you can and cannot take the morning of your surgery. The only medical equipment that is required for your surgery, whether it be a knee replacement or a hip replacement, will be a front-wheeled walker. This walker, as you can see in the picture, has 2 wheels in the front and posts in the back. Sometimes you see tennis balls on these posts. Optional medical equipment can be a raised toilet seat, a shower chair, or a grab bar. Now, all of these items can be purchased at durable medical equipment companies, CVS, Walgreens, but they can be a little pricey. Especially for a front-wheeled walker, I encourage people, if they have Amazon, you can find them online for very inexpensive and they deliver it right to your home. Or even local thrift stores have them, sometimes brand new, for very inexpensive. The wrong equipment that you do not want to use right after your surgery includes a rolling walker. This walker has 4 wheels and typically has a seat. This is not sturdy enough for you to use right after your surgery. A standard walker is another piece of equipment that you do not want to use right after your surgery. This walker has no wheels with 4 posts and highly increases your risk of falling. Crutches are another piece of equipment that you will not be required to use after surgery. Planning and preparation is key for success. Prepare your home in advance and create a safe and easy to maneuver environment. Move things that you normally use within easy reach, like remotes, pantry items, bathroom toiletries, and etc. Make meals ahead of time and go grocery shopping in advance. Remove all rugs and have a clear walkway to prevent tripping and falls. It may also be helpful to install night lights so you can see if you have to get up during the night. What to bring to the hospital? You may want to bring your joint education manual, clothing such as loose pajamas, short nightgowns, short robes, loose shorts, t-shirts, undergarments, and/or jogging suits. You don't want to have any long or dangly articles of clothing because they could catch into your walker, they can get into the way of you performing physical therapy, and they can just also increase your risk of falls. And shoes with a back and non-skid soles so that you can walk easily throughout the hallway. What to bring to the hospital continued: personal hygiene toiletries, eyeglasses, contact lenses, denture case, your hearing aids and their batteries. If you do use a CPAP machine, please bring the machine and the tubing. We will provide the water, a cell phone, and your cell phone charger. Some reminders: you want to leave your jewelry, credit cards, checkbook, and your cash at home. Do not bring any medication with you to the hospital unless instructed to do so. We do have a pharmacy here at the hospital that dispenses all medications. Plan meals ahead for when you return home. Purchase groceries in advance and make sure to have plenty of water to prevent dehydration. And remember, no food or drinks after midnight the night before your surgery unless you were told otherwise. On the day of surgery, before you leave home, make sure you shower using the special instructions given to you during your pre-op appointment. Some surgeons' offices provide you with a special soap that you will be using, but others require you to go out and purchase them yourself. Take only the medications you have been instructed to take with a small sip of water. And remember to check with your primary care physician for instructions on medications you take on a daily basis, such as insulin and Coumadin. And don't forget, the pre-op nurse that you interviewed with at the hospital will also go over these medications with you and what is safe and not safe to take the day of surgery. When you arrive at the hospital, you will come to the outpatient surgery area located on the south side of the hospital, and you will park in parking lot E. You will come through the automatic doors and proceed to the outpatient surgery registration desk to check in. From here, you will be escorted to the preoperative surgery area. You will be prepared for surgery in the pre-op area of the outpatient surgery. A nurse will start an IV and confirm the planned procedure. Your operating room nurse and a member of the anesthesiology team will speak to you about the type of anesthesia that will be used during surgery. They will escort you to the operating room where your surgeon will confirm the correct site for surgery. After surgery, you will be in the recovery room until you are awake, your pain is under control, and your vital signs are stable. There are 2 types of visits you can be under when you have a joint replacement surgery, which includes outpatient, meaning you go home the same day of your surgery, and inpatient, meaning you stay overnight in the hospital. Your surgeon will discuss this with you prior to your surgery so you know ahead of time. For outpatient surgery, if your surgeon plans for you to go home the same day as your surgery, you will be brought back to the outpatient area from the recovery room where nurses and/or physical therapists prepare you for discharge home. Criteria for this kind of surgery includes that you are physically active and in good general health, you attended or watched the joint education class, you have a 24-hour caregiver available or somebody that you live with, transportation to and from the hospital and your appointments, and no environmental barriers such as long staircases. A really important thing to note is that you will want to have your walker already purchased and in the car ready for when you go home, and have your outpatient physical therapy already set up and the appointment made. If you are going home the same day as your surgery, from the recovery room, you will return to the outpatient unit where you started. Nurses and physical therapists will work with you to prepare you for discharge, and if you are able to walk 150 feet, your pain is controlled, and you are alert after anesthesia, you will be discharged home that day. For patients staying in the hospital after surgery, meaning you're an inpatient, you will be taken to the orthopedic unit located on the 8th floor of the hospital. Your friends and family will be notified of the room number once it is available. Our orthopedic unit is a medical surgical floor. There are 30 private rooms. Our visiting hours vary, but we do ask that you limit the amount of visitors on the day of surgery. Here at the hospital, your team will include your surgeon and their assistants, nurses and patient care technicians, physical and occupational therapists, an orthopedic coordinator, and a discharge planner or social worker. You will be admitted to the hospital for 1 to 3 days or longer depending on your medical condition. At the hospital, we will frequently monitor your vital signs and assess your surgery site. We will manage your postoperative pain, give you IV fluids, antibiotics, and medications as ordered, including your home medications, monitor your oxygen level, and educate and prepare you for discharge. Remember, do not get out of bed without assistance from a hospital staff member. Do your ankle pumps every hour. This is done by moving your ankles up and down slightly and wiggling your toes. Turning in bed will help prevent skin breakdown, blood clots from forming, and lung congestion. The hospital staff will also help with you turning in bed. Not every surgeon orders compression stockings, but if your surgeon does, they will be placed on you after surgery, and the nurses will go over how to continue their use at home when you are discharged. During your hospital stay, your physical therapy will begin the day of surgery, and you will be out of bed and walking within 6 hours. The physical and occupational therapist will work with you to begin a program tailored to your needs. Remember, getting up on the day of surgery aids in your recovery and helps prevent complications. Therapy. Therapists typically work with you 1 to 2 times daily, depending upon your progress and your time of discharge. The basic goal is for you to be independent and safe in your home environment, including bed mobility and transfers, activities of daily living, walking, exercises, and following precautions. Therapy will assess your needs for equipment, such as a shower chair, raised toilet seat, and etc., and let you know if you need to purchase these things when you go home. We do have a fall contract here at Flagler Hospital. You always want to have a staff member assist with a gait belt when getting up to prevent falls. Therapy will let you know when it is safe for you to get up with family assistance independently without a staff member. A knee brace may be used to support your knee while you are walking if needed, but your surgeon will order that if necessary. Some therapy pointers. Do not place a pillow under the knee when resting, or you will have difficulty straightening your knee or hip. Put a pillow, a towel, or a blanket roll under the ankle so that gravity can help straighten your knee. Practice getting your knee and hip straight to prevent further complications in the future. Some hip pointers. To prevent a possible dislocation of your new hip, most patients will need to follow hip precautions. Avoid these 3 basic hip movements. Avoid extreme hip extension backwards, like a backwards lunge. Avoid extreme hip abduction away from the middle, meaning your legs are spread wide open. and avoid turning or twisting while your feet are planted on the ground. An incentive spirometer. Incentive spirometry is a deep breathing exercise that your surgeon will order to assist you after surgery. Deep breaths are needed to expand the air sacs in the lungs. This prevents lung problems like pneumonia, and it also speeds your recovery. The hospital will provide you with an incentive spirometer, and remember to continue use at home after discharge from the hospital. How to use your incentive spirometer. Sit upright, as far upright as you can. Breathe out normally. Close your lips around the mouthpiece. You will breathe in slowly and steady throughout your mouth until your lungs are full. Remove the mouthpiece and hold your breath for 5 seconds, and then breathe normally. You want to repeat this exercise 10 times every hour while you are awake, but do not do all 10 in a row. Don't forget, the nurse and respiratory therapist will guide you through this at the hospital to show you exactly what to do. Some complications to be aware of are blood clots. A blood clot in your leg is called a DVT, also called a deep vein thrombosis. And symptoms that you will experience could be increased pain in your lower leg outside of your incision, tenderness and/or redness in your leg, ankle, or foot, increased swelling in the leg, ankle, or foot, sudden shortness of breath and/or chest pain, and you will want to call your doctor if you have these symptoms. A blood clot that travels to your lung will be a pulmonary embolus, and this is a 911 emergency. Symptoms include sudden difficulty breathing and chest pain with anxiety. Again, call 911 if you have these symptoms. To prevent blood clots, you will be placed on a blood thinner. You will be instructed by your surgeon to take a blood thinner after surgery to help prevent a blood clot. This may be a prescribed medication or an over-the-counter medication such as aspirin. Other preventions for blood clots include elevating your feet using pillows to raise your feet higher than the level of your heart while lying in bed. TED hose, also called compression stockings, are elastic support stockings that help improve blood flow, but remember, not every surgeon uses these stockings. Perform the exercises instructed by your surgeon and physical therapist. Get up and walk every hour, which helps with your blood circulation. Avoid sitting with your legs crossed, and avoid prolonged bed rest. Surgical site infections. A surgical site infection is an infection that occurs after surgery in the part of the body where the surgery took place. The risk of a surgical site infection is low, but it can happen. Ways to prevent surgical site infection include avoid touching your dressing or incision. If you do need to touch your dressing or incision for any reason, clean your hands with soap and water for at least 20 seconds before doing so. Have your friends or family clean their hands with soap and water before coming into contact with you. And remember, the skin around your incision may begin to itch as it heals. It is important not to scratch with long fingernails. Scratching could introduce bacteria to the surgical site and cause an infection. And please remember, keep your pets off of your lap and away from your incision. Pain management. During your hospital stay, you will be asked to rate the intensity of your pain that you are experiencing. A numbered pain scale is used and ranges from 0 to 10, 0 being no pain and 10 being the worst possible. Some pain management options include intravenous or IV pain medication, oral pain medication, MOD or medication on demand, ice therapy, change of position, and in some cases, an anesthesiologist will use a nerve block. For your pain management, it is really important to communicate with your healthcare team if the pain medication is not sufficient, if you are not as alert as you think you should be, or if you are nauseated. There will be different types of pain control methods available to you that will keep you comfortable and allow you to be up and walking shortly after your surgery. Your surgeon will choose the right method for you based on your medical history and the amount of pain you are having. And remember, it is important to stay ahead of your pain. For your discharge, your physician and hospital staff will discuss your discharge plan with you based on your medical needs. Once your plan has been decided, arrangements for your care and equipment will be made for you by a coordinator before you leave the hospital. Your hospital discharge options include, number 1, return home with outpatient physical therapy, which is the most preferred option. Option number 2 could be return home with home health care, where a nurse and a physical therapist come to your home, usually about 2 to 3 times a week, and they help with your physical therapy and nursing needs at home if you don't have transportation or if you are homebound. And option number 3 would be to go to a skilled nursing facility prior to returning home, and that is the least preferred option. Our goal is to get every patient back to their home where they are safe and can recover quickly. So for your hospital discharge planning, a discharge planner will discuss progress towards your discharge goals. They will arrange services for your home health if you need it, your inpatient rehab if required, transportation, non-emergency, if you need to go to an inpatient rehab, and medical equipment if you are not able to obtain those prior to your surgery. Remember, it is your responsibility to make an appointment for your outpatient physical therapy after surgery. The hospital will not do that for you. After your surgery, you may experience some decrease in appetite, difficulty sleeping, and low energy level. But remember, all of this gets better with time. Pain medication containing narcotics can promote constipation. It is important to stay hydrated, increase your fiber intake, and increase your activity level. Constipation. Pain medications and lack of activity can cause constipation. In order to prevent this, increase your fluids, mostly water, increase your fiber, including fruits, vegetables, and bran. Prunes and/or prune juice can be helpful, and also increase your walking. Stool softeners will also make it easier to have a bowel movement without a laxative effect. You may use an over-the-counter laxative if needed, like a Miralax or a milk of magnesia. For your dressing, you will be instructed before you leave the hospital how to care for your dressing. Keep your dressing dry and clean. You will be able to shower at home. If you want, you can wrap your dressing in saran wrap before showering. Do not submerge your dressing in water, like bathtubs, pools, or the ocean. Your incision. Once your dressing is off, wash your hands before touching the incision. Wash the incision and the skin around it gently with soap and water. Pat the incision dry with a clean, laundered towel. Do not rub a towel over your incision. No tub baths, swimming pools, or hot tubs until your incision is completely healed, and this is different for each surgeon. Do not use any creams, lotions, ointments, or alcohol on or near your incision. Call your surgeon or care coordinator at the hospital if you notice an increase in drainage, redness, pain, odor, and/or heat around your incision area. For the best results, keep your education manual handy. Refer to it and stay on track. Do the exercises correctly. Don't overdo it. Mix activity with rest. Gradually increase your activity level. Expect some discomfort. Take your pain pill 30 minutes before your exercises. Use your ice pack and elevate your leg. For the best results, doing the exercises and following all post-op instructions will ensure the best outcome. Stay focused on the big picture and returning to the things you enjoy. Remember, only you can ensure your own success. This concludes Flagler Hospital's joint education class. We hope that this information has been beneficial for you and that you feel more informed and ready for surgery. We look forward to caring for you, and thank you again for choosing Flagler Health Plus.